Hi everybody, Dr. Nikita Vizniak with the amazing super therapist,
Magdalen, Farley.
and today we're going to talk a little bit about breast massage. So what conditions can benefit from breast massage? The best massage, breast massage. Maybe not.
Lots of different conditions. So one of the things that we do wind up recommending is honestly just regular breast care. A lot of the time, women wind up with a lot of tenderness regarding their menstrual cycle. You can also wind up with fibrocystic breast changes that happen as women get older through menopause and things like that. So it can be helpful for just regular breast care. There's also conditions around perinatal and childbearing. So obviously breast tissue goes through a significant amount of changes. They grow and change, and that can be quite uncomfortable. Postpartum, you can wind up dealing with postpartum mastitis. So massage therapy can be very helpful for all of that. And then, of course, we wind up getting into post-surgical areas. There can be breast augmentations, breast reconstructions, reductions. And then, of course, we get into the area of post-lumpectomy and mastectomy when it comes to cancer. This is Cancer Month, so we are particularly wanting to draw our attention to that area.
So big question then, how can massage be of benefit after massage therapy? One of the typical things I see in my patients is they often describe after mastectomies are done or any kind of surgery is done, everything just feels like it's pulling and curling in around their shoulders like this.
So when it comes to after cancer treatment, there's a lot of different things that we would want to look into. We'd want to look into helping restore range of motion for both the shoulders and the arms, the neck, all of that region. So we can look into decreasing all of the discomfort regarding that. There's also, of course, regular post-surgical pain, post-surgical scar tissue that we would wind up dealing with no matter what the surgery was. Even through chemotherapy, they put chemo ports in various areas, and those scars can wind up pulling and causing some discomfort.
Well, yeah, there's another condition, axillary web syndrome and lymphedema. How do we deal with those?
So those are possible complications, and those are things that we would both want to hopefully prevent with some massage therapy. There are treatments of manual lymphatic drainage that we can do to help treat lymphedema. We would also wind up putting our patients on the alert for risk factors to look out for. A lack of active range of motion, a lack of exercise and mobility after surgery can wind up precipitating for those conditions. Axillary web syndrome and lymphedema as well. It's worth noting that patients in a specific demographic of being sedentary and having a higher BMI are at particular risk, especially following lymphectomies and lumpectomies and things like that. When they remove, the more lymph nodes they remove, the more at risk a woman is for developing lymphedema.
Just the more scar tissue formation you're probably going to see with it, right?
Yeah.
Okay, so what can we do for massage therapy during active cancer treatments?
Yes, I'm glad you asked, because a lot of women think it's not safe. They've been told that they should be avoiding things, that it could spread the cancer. There's not really any particular significant evidence to suggest this. And in fact, it can actually be a really important part of stress relief, a lot of mental care. We do want to talk about one of the things that massage therapy can help provide is stress relief, decrease of depression, anxiety, all of those psychosocial factors,
yes,
right?
Absolutely.
So there's a lot of things that we can wind up doing to support them through that whole process. In terms of the treatment of lymphedema, we can do manual lymphatic drainage. When it comes to treatment of axillary web syndrome, we can wind up doing that. There are a few little precautions that we would take, though.
Important to go over.
Really important to take. So it's important to notice that during the recovery period, right after surgery and in the coming weeks, there are a couple of things that you would want to avoid. So in terms of aggressive pressure, sometimes RMTs are not particularly educated in this area and will do their normal amount of nice deep pressure, not only just in the chest, but in the area of the back. Some RMTs don't really recognize that there are lymphatic tributaries in the posterior of the body. And so you would want to decrease the amount of pressure that you'd use in those areas, both in the pecs and in the back, in order to be careful about not inciting lymphedema.
Exactly. Touch is important, but too much touch could actually potentially be damaging as well, right?
There are areas, even in those early phases, though, that you could still wind up treating. So you could work on the legs, you could work on the arms. Scalp massage can be incredible for stress relief. And if you're just coming in maybe for a shorter treatment time, you could have areas worked on. As long as you are comfortable lying in a face-up position, you can receive massage.
All right, super therapist Magdalen. What should women be doing for prevention of breast cancer? There's 101 things. Give us your top choices.
So obviously, early screening is the most important part of that particular thing. Check your pumpkins for lumpkins. So this is Cancer Month and Spooky Month, so we want to be really kind of focusing in on that. Obviously, all self-exams should also wind up being, if you find anything, go back to your doctor. Regular mammograms are recommended for women over the age of 50 every 2 years. When it comes to self-exams, you can probably start doing them as early as you want. While 80% of cancer cases, breast cancer cases in BC are found in women over the age of 65, you can absolutely get it much younger. There is also important to note, and I'm going to put a link to this in the description box below. There is a BC cancer screening program for women that you can self-refer to if you are between the ages of 40 and 74. You can be moderate risk, which is to say you don't have any particular reason to be concerned about cancer. You're not having any symptoms. You don't have a significant history of cancer in your female immediate family, and you don't have a history of cancer yourself. In that case, you may absolutely self-refer after the age of 40, and you can just go in, book yourself in for a mammogram screening anytime you want. Over the age of 50, they recommend it every 2 years.
Okay, good to
When
know.
it comes to self-exams, it's important to perform them regularly. If you are still in your menstruating years, you want to perform them preferably on day 7 to 10 of your cycle, which is to say 7 to 10 days after your first day of your period. With that, they say that there is less tenderness generally, as well as fewer regular normal lumps and bumps felt in the tissue, so it'll be easier to define whether or not the lumps you're feeling are normal or abnormal. You want to perform them regularly in the mirror as well as lying on your back. We're going to put another link in the description box for how to perform them.
And being consistent with them as well, like same patterns, same movements all the way through, so you're covering all the tissue.
Yes. If you are past ages of menstruation into your postmenopausal years, they just recommend that you do them on the same day every month. So pick a month, first day of the month, last day of the month, 15th of the month, put it on your calendar and perform it on the same day every month.
And then, of course, for cancer prevention, all the other stuff is there as well. Exercise is proven to reduce risks of cancers, making sure you have good dietary choices, and good social connections are all related to overall health, as you were talking as well.
That's a really important point as well. It's important to have really good communication, not just with you and your healthcare professionals, but between the healthcare professionals.
Absolutely.
So it's really good to have a good communication between the various people on your team. I work with some incredible therapists here. I also want to give a quick shout out to RMT and Stores and physiotherapist May Lai, who are also experts in the area of breast cancer and who gave me a lot of information for today.
Super good. How can people find you, Magdalen?
I am here at Pro Health Clinics in New Westminster. We are at prohealthclinics.com, I believe.
Yep, that's right.
And in the meantime, happy spooky month. Check your pumpkins for lumpkins.
All right. Enjoy, and thank you very much for your time.